Welcome to the webinar Disaster Risk Management from a Gender Perspective. My name is Cristina de San Roman, a communicator specializing in disaster risk management, and I will be accompanying you throughout this activity. Let's begin with a brief context of the issue. Emergencies and disasters significantly increase the levels of vulnerability of women and men, but in different ways. In fact, it places them in high-risk situations that bring with them needs that must be addressed in a differentiated manner. Specifically, in the case of women, it is recognized that emergencies and disasters significantly increase their levels of vulnerability. Precisely because in relation to gender characteristics, social disadvantages, gender relations, access or lack of access to resources, violations of rights, and barriers to participating in decision-making in risk management, women are at a disadvantage compared to men. And while it is true that the primary response in an emergency aims to save lives, action should not only focus on removing people from life-threatening situations, but also on supporting those individuals, those family groups, or specifically those women, so that they are not exposed to other risks that begin to arise around the emergency. Indeed, the Sendai Framework for Disaster Risk Reduction focuses on the participation of women to effectively manage disaster risk, as well as to design comprehensive resources and implement policies, plans, and disaster risk reduction programs, but specifically with a gender perspective. Equipping the population with knowledge in this area and practical tools that can be implemented in communities is the objective of this webinar. And for this, we have the participation of two excellent speakers, whom I have the pleasure of introducing next. The first speaker I would like to introduce is Joanna Ureña 2009. Joanna Ureña is the co-founder of Colectiva Rigen, a geographer with experience in disaster risk management, intersectional gender focus, and feminist urbanism. She works for the American Firefighters Organization, where she supports the interinstitutional coordination of the Special Permanent Commission on Gender Equality and Diversity. She has experience in research on comprehensive disaster risk management and gender perspective projects, collaborating with the World Bank, the Latin American Vehicle Rescue Association, and the Confederation of Central American Fire Departments. Welcome, Johanna.
Thank you very much. It's a pleasure to be here.
Thank you. We also have Natalia Viques with us. Natalia is a co-founder of Colectiva Rigen, a geographer and cartographer with experience in disaster risk management, social cartography and participatory methods, geographic information management systems, and database organization. Natalia has worked in technical support teams in international consultancy processes for the development of policies, plans, and projects in disaster risk management. Welcome, Natalia.
Thank you. It's a pleasure to be here as well.
Very well. Thank you both for being with us at this moment in this webinar, and I will give you the space to start your presentation.
Thank you very much, Cristina de San Roman, for your introduction. It is a pleasure to greet you all. My name is Joanna Ureña 2009. My colleague Natalia is also with us. Next, we present the initial definitions that underpin our work and vision in the collective. The first fundamental concept is the concept of gender, which encompasses much more than the biological differences between men and women, as it is a social construct deeply rooted in our culture, and time, defining the roles, behaviors, activities, and attributes that a society considers appropriate for each gender. Beyond simply labeling, gender also shapes our interpersonal relationships and our expectations in every area of life. According to Mujeres, gender is not a fixed attribute, but a dynamic construction that influences every aspect of our daily lives. This social construction determines not only what we expect from people based on their gender, but also the opportunities that are provided to them and the barriers they face. Therefore, understanding gender is essential to promote equality and justice in all areas of our lives and our societies. To address gender in a comprehensive manner, it is essential to incorporate a human rights perspective. These rights are inherent to all human beings, regardless of sex, nationality, ethnic origin, language, religion, or any other condition. In essence, human rights guarantee fundamental aspects of our dignity and freedom, including the right to life, the freedom from being subjected to slavery or torture, the freedom of expression and opinion, as well as access to education and work, among others. As stated by the UN in 2020, these rights are universal and apply to all people without discrimination. This universality not only establishes a framework for justice and equity, but also guides governmental, institutional, and collective actions, ensuring that everyone receives fair and equitable treatment, promoting an environment in which each individual can fully exercise their rights and freedoms. On the other hand, intersectionality is a crucial approach that will help unravel the complexity of differentiated vulnerability. By highlighting the historical and specific equity needs that have often been overlooked in development processes. This approach recognizes that individuals do not face inequalities in isolation, but rather their experiences are influenced by multiple factors such as gender, social class, sexual orientation, among others. Applied local disaster risk management, intersectionality offers a powerful framework to guide planning, investment, analysis, and the formulation of public policies. It is not just about adapting traditional strategies, but about going beyond the conventional operational space to address the underlying causes of differentiated vulnerability and improve the risk conditions affecting women and individuals with non binary or LGBTIQ identities. From a political action and public management perspective, intersectionality has the potential to transform invisible knowledge into visible capabilities. By doing so, it can reclaim and give value to the voices and realities that have been historically marginalized, thus promoting a more inclusive and equitable risk management. Positioning the intersectional gender approach in disaster risk management processes makes visible the differentiated vulnerabilities and capacities to build processes that are more focused on the needs of individuals and more participatory, which allows for strengthening a comprehensive perspective of disaster risk management in light of human development. With intersectionality as a framework, we can now explore how stereotypes and social norms influence the way individuals experience vulnerability and risk. Gender stereotypes are generalized beliefs or ideas about how people should be according to their gender. These preconceived ideas profoundly affect the way we perceive and treat others. On the other hand, social norms are the rules and expectations established by society that dictate how individuals should behave based on their gender. These norms influence all aspects of life, from the way we dress and speak to our job options, family roles. For example, in some cultures, women are expected to take on the role of primary caregivers, while men are expected to be the primary providers. These stereotypes not only limit the opportunities and freedom of individuals, but also perpetuate inequalities. However, it is crucial to recognize that not everyone fits these stereotypes and norms, and that challenging and reconfiguring these expectations is essential for advancing towards true gender equality. These concepts reflect the power dynamics and inequalities we face and must be addressed to achieve a more equitable and inclusive disaster risk management and development. These social stereotypes can also be reflected in the following concept, which is gender gaps. Gender gaps reflect the persistent social inequalities between men and women in areas such as education, employment, health, political participation, and decision making. These disparities arise from a combination of social, economic, cultural, and political factors that perpetuate gender discrimination and inequality. An illustrative example of how these gaps affect disaster risk management can be found in the design of shelters and temporary refugees. According to data from UN Women in 2021, in emergency situations, shelters often do not adequately consider the specific gender needs This is manifested in the lack of intimate hygiene facilities and adequate private spaces, as well as the absence of trained personnel to address specific needs, such as medical care for pregnant women or protection against gender based violence. Research also indicates that, in many cases, shelters are not designed with sufficient consideration of gender differences in terms of safety and privacy. This can result in environments that are not only unsafe, but also exacerbate the specific vulnerabilities of women and girls during disasters. The lack of attention to these issues contributes to the persistence of gender gaps and also limits the effectiveness of humanitarian responses. Addressing these gender gaps is essential to ensure that disaster risk management is inclusive and sensitive to the needs of all individuals, promoting a more equitable and safe environment. The term LGBTQ represents a broad spectrum of identities and sexual orientations. This acronym encompasses a variety of experiences that include diversity, sexual orientation, and gender identity. The symbol at the end of the acronym reflects the inclusion of all identities and orientations that are not specifically represented in the letters, underscoring the diversity and more influence within the community. Recognizing and supporting LGBTQ individuals is essential for promoting equal rights and respect for diversity in our communities and in disaster risk management. On the other hand, non binary identities encompass a variety of gender experiences that are not limited to the traditional categories of male and female. According to Matsu and Monroe, binary individuals can experience a spectrum of identities that include both masculine and feminine aspects at different times, or even not identify with any specific gender at all. This diversity within the gender spectrum challenges conventional notions of identity, but it also highlights the need for an inclusive approach in all areas of life, from disaster risk management to development. Recognizing and understanding non binary identities is crucial to ensure that policies and practices are sensitive to the needs of all individuals, promoting a more inclusive and equitable environment. By integrating these perspectives into the planning and execution of strategies, especially in emergency contexts, it can be ensured that responses are appropriate and respectful of the diversity of gender identities. This not only promotes a fairer and more equitable treatment, but also enriches the response and support capacity for all affected individuals. On the other hand, gender based violence refers to any harmful act performed against the will of a person based on the social differences attributed to women, non binary individuals, and men. This form of violence is closely related to social stereotypes that perpetuate gender gaps, reflecting the inequalities and discriminations inherent in society. A concrete example of how these gaps manifest in practice can be observed in shelters during disaster situations. After the hurricanes Eta and Ota that swept through Central America in 2020, an assessment was conducted in Guatemala. According to this report from UN Women, in the 13 shelters visited, the responsible individuals indicated that there were no sexual and reproductive health services. 45% of the shelters did not offer services for pregnant women, either in the facilities or in the surrounding areas, and only 64% had health services at the nearest health centers. Additionally, the overcrowding in these shelters, where many families remain in the same space, increases the risk of sexual violence, especially against women, girls, and adolescents. 2009. This lack of adequacy and services not only exposes existing gender gaps, but also exacerbates vulnerability conditions and perpetuates gender based violence. These data underscore the urgent need to design and manage shelters that adequately address the specific gender needs, ensuring a safe and accessible environment for all individuals affected by disasters. Integrating a gender perspective in risk management is essential to prevent and respond to gender based violence and to promote equity and safety for all individuals.
Thank you, Johanna, for this first delivery of information. To continue, I would like to present the testimony of the professional Isabel Hernandez. She is a specialist in clinical psychology and a professor at the Dominican University OIM in the Dominican Republic. Isabel, as a field expert, precisely addresses in her testimony some of the recommendations and suggestions that Joanna Ureña 2000 has been sharing with us today. Let's listen to her.
There are international standards that must be ensured for the evacuation process and temporary relocation in shelters or collective centers. Taking gender considerations into account goes beyond ensuring that women and girls are displaced to a safe place. It must necessarily include protective elements. For example, when I am conducting an evacuation, the first guarantee I must have is that the location where I am relocating this vulnerable population has adequate sanitary conditions and that these sanitary services are differentiated for men and women. They should have an appropriate lighting system, and there should be a trained and prepared shelter manager, a collective center that can help mitigate and reduce the risks of vulnerability. And not only girls and women, because boys are also vulnerable to abuse, harassment, trafficking, and exploitation in vulnerable or disaster contexts. Gender considerations are also closely related to obstetric care in emergencies. I am relocating a group. Among them, it is likely that there will be pregnant women, including adolescents. As my evacuation plan and my shelter plan must consider quality obstetric care, taking into account these age group differences, and also considering elements such as female menstrual hygiene. A woman in a collective center during her menstrual days is not the same as a woman who can manage her situation with the necessary conditions at home, and this must also be taken into account, considering those risk elements as well. As previously mentioned, every evacuation plan and every collective center must include in their family care kit the post-exposure prophylactic kits so that care and the guarantee of rights are covered from different holistic perspectives. It's not just about considering whether the people I am relocating have food. They do have food, but in what condition? So, talking about considering this gender means knowing how to be, knowing with whom, and having the means to respond to any eventuality.
Very well. We continue with the presenters, Natalia and Joanna, who will delve deeper into more concepts related to disaster risk management from a gender perspective and will share some application examples with us. Go ahead.
Thank you. To continue this exploration of the concepts, we would like to introduce three important concepts that are linked to the theory of risk management, which serve as a bridge for understanding the analysis of intersectionality in the processes we have already worked on. The first is vulnerability. This concept refers to the conditions and positions of different social actors as individuals subject to rights within the framework of socioeconomic group, gender, ethnicity, cultural identity, and the variables implicit in the life cycle, childhood, youth, adulthood, and old age. This allows us to conduct an analysis incorporating this concept to act, evaluate risk concepts, and risk contexts, taking into account the diversities and inequities of different populations with the aim of providing comprehensive care, protection, and guaranteeing rights, which qualifies institutional and community responses. Another concept that we have chosen to bring up here is the differentiated impact. We refer to this that men and women can experience and face risks differently due to social norms, gender roles, and structural inequalities. By adopting this approach, it is possible to identify and address the specific needs of women and marginalized populations in disaster planning and response. Recognizing the territory as an ecosystem and system, as a physical, natural, and anthropized space, and its relationship with the communities that inhabit it, as well as a scenario in which we face multiple threats that act on these multi-vulnerabilities, we could see the differentiated impact as a pathway that leads us to explore the differentiated capacities of each individual And precisely the next concept we would like to discuss and bring up here is about differentiated capacity. We refer to these conditions for action and management that a population possesses within a disaster development context. For example, we believe that this goes hand in hand with validating feelings, stories, and territorial experiences. It allows us to understand that these stories of individuals and what they may go through are often intersected by stereotypes, violence, and other factors, and they are not heard and therefore not taken into account in the processes of decision making. For example, this approach can be applied in shelter planning, as my colleague Joanna has been explaining. We consider the case of a woman who, after a flood, must take care of her elderly parents with some form of disability while waiting to cook. For others in the shelter, this situation can lead to an exhausting workday, accumulating stress and fatigue. Good planning could include a redistribution of tasks in the shelter so that all community members, such as adolescents or others, can help with tasks, for example, cleaning and coordination. This would allow this person, this caregiver woman, to have time to rest and better attend to her responsibilities without the burden disproportionately falling on her.
Implementing a gender approach in disaster risk management is a process that may require years of significant continuous efforts. However, it is crucial to consider both short-term and long-term actions to address and improve the conditions of inequality. We can also take different key actions to move towards a more inclusive and equitable risk management. For example, we can take responsibility for reaching, protecting, and empowering women and girls equally, ensuring that their needs and capacities are considered at all levels of disaster risk management. We can break away from the notion that women are vulnerable as an intrinsic condition of themselves. We can also incorporate specific criteria, actions, and investments to address the gender approach in intersectoral solutions. Furthermore, incorporating specific criteria and making targeted investments to address the gender approach within intersectional solutions ensures that strategies and policies consider the needs and perspectives of all genders. On the other hand, we can also study the patterns of differentiated vulnerability to develop analysis and research tools that identify and address the specific needs of different groups. We can also design methods to incorporate the results of the risk analysis into governance instruments, ensuring that policies and strategies reflect the reality of all affected groups. Finally, we can also promote control mechanisms from a gender-based human rights approach, incorporating human rights bodies and community organizations to ensure effective oversight. 1. Just response. And finally, make gender-focused training mandatory for all professionals in emergency care, ensuring that staff are prepared to respond in an inclusive and equitable manner. To advance the integration of a gender perspective in disaster risk management, it is essential to start with concrete actions that establish a solid foundation. So, here we present some starting points to guide our efforts towards a more inclusive and equitable management. Firstly, we must identify existing gender gaps and prioritize needs. Conduct detailed studies and analyses to identify gender inequalities in the community and how these affect vulnerability and resilience to disasters. Surveys and interviews with different community groups can also be used, for example, to better understand the specific needs and priorities of women and individuals with non-binary or LGBTQ identities. Ensure the effective participation of women and non-binary individuals in all processes. Ensuring that women and non-binary individuals are effectively included from the beginning in decision-making and planning in disaster risk management. Also, develop and implement policies that promote gender equality and inclusion at all stages of disaster risk management. On the other hand, conducting training on human rights and gender perspective in all functional areas of institutions, organizations, and communities. In order to develop training programs that address human rights and the gender perspective, ensuring that all levels and functional areas of institutions, organizations, and communities understand and apply these principles, and also to monitor and evaluate the impact of these trainings to adjust and improve the programs as necessary. And finally, to design methods to include the results of these differentiated risk analyses in governance instruments, ensuring that the outcomes of this differentiated risk analysis incorporate a gender perspective and are also integrated into governance instruments, such as development plans, public policies, and regulatory frameworks, in order to promote cooperation among various institutions and organizations to ensure more inclusive and effective governance.
Thank you, Joanna. Yes, we would like to continue by bringing two practical examples of how this application could be. The first thing we see is, well, shelter management with measures for gender-based violence as part of disaster risk management processes. Here we have the key concept of gender-based violence, which refers to any harmful act committed against the will of a person due to attitudes, beliefs, norms, and structures that promote or condone discrimination based on gender and unequal power. So, keeping this key concept in mind, shelter spaces are generally identified prior to their use, and there are minimum standards that they must meet for shelter management, such as the Sphere Handbook. However, it is vital to strengthen the integration of actions for the prevention, referral, and care of cases of violence related to gender. Within these standards and manuals, as differences in sex, gender identity, sexual orientation, age, and others have generally not been included, and this needs to be updated. So, for example, we could ask ourselves, what do I do if I am a person or a health worker working in a shelter during a disaster and a trans man comes to ask me for a sanitary towel? How can we manage a situation of a basic need in a context of respect? That is a question we ask ourselves in order to assess how we could manage a situation like that. So we thought, well, what could be a key action, a design, a prior execution, an update of these shelter management protocols with the approach of including gender and intersectionality within these specific concrete actions for the care of individuals in a shelter. For example, it should include the prevention, care, and referral of gender-based violence. Another very concrete example we bring is the planning of actions in decision-making with a gender perspective. Here we have another key concept, which is the gender approach, reminding us that it is this theoretical, practical perspective that makes visible the historical inequalities and discriminations that exist between men and women and non-binary identities. Therefore, it is this particular vision of interpreting society from the perspective of people as historically discriminated subjects. So, we return to a case where public health and healthcare require this approach for planning and decision-making, both in hospital and community contexts, and in the midst of risk and disaster scenarios. Ignoring these gender differences means that we are overlooking 50% of the population, for example, when referring to women. So we ask ourselves whether the annual operational plans of my organization or institution include specific actions with a gender focus. Who makes these decisions? Who is updating these protocols? A key action could be the review and update of these operational plans to give them a vision or include a gender perspective with the aim of incorporating these actions and allowing for the integration not only of the perspective, but also of reducing the gaps that can arise from actions that standardize all people equally, right? By identifying differentiated vulnerabilities and differentiated capacities.
And well, as part of the conclusions, the strategies we discussed today call us to a renewed commitment to adapt our actions to the differentiated capacities and vulnerabilities, to respect and value the diversity in our communities, and to identify and overcome the barriers that limit inclusion. For this reason, it is important to break with gender stereotypes and ensure the inclusion of all individuals in the processes of disaster risk management. Develop strategies based on the differentiated capacities and vulnerabilities in the territories. Integrate, understand, and respect the way of life of women, non-binary individuals, and the LGBTIQ community And finally, identify the barriers and difficulties to advancing the incorporation of a gender and intersectionality approach, and create mechanisms to counteract these inequalities or gender gaps. Thank you all for your attention and participation in this important webinar on the integration of the gender approach in disaster risk management.
Thank you very much, Joanna. Thank you very much, Natalia, for this excellent intervention. This is definitely a topic with which we started this webinar, and we are left with a lot of information, but above all, understanding that the issue of gender and gender gaps is something we must continue to explore and analyze to change the social structure we have, right? And specifically in disaster risk management. Thank you both for your participation. We thank all the individuals who joined this webinar, which is part of the Educational Capacity Development Platform in Disaster Risk Management, promoted by UNESCO and the Government of Japan. Everyone who connected will be receiving a certificate of attendance in their emails in the coming days, and they will also receive information to participate in the next webinar of this series of webinars. Thank you very much. We look forward to seeing you.